Well, hello, good evening, viewers, and thank you for joining us this evening. You know, the show Ask Dr. SAWH has been very popular, and Dr. SAWH was away for some holidays, and there was a lot going on in the country. So we decided we were gonna take a little break, but we're back, and we are back with a bang. Tonight we are here, and the man himself is on. He's still in England. Hopefully, he gets back here very soon. Good evening to you, Dr. SAWH.
Good evening, Akash, and the viewers.
Wonderful, Dr. SAWH. We took a little bit of a break, but we are here again. Today we can just be doing half an hour. And viewers, remember, this show is about you. You get an opportunity to send in your question to us. And next week, during our next live broadcast, we are going to be answering your questions from this week. So this show is about you. It's bringing educational and medical material to you so that you will know from a layman's perspective in many ways what are some of the things affecting you. And we have with us an expert in what I say is an expert in Dr. SAWH, because so far the way he has been delivering on this show has been just amazing, and I know that every one of you would have missed him, but here he is again. And Dr. SAWH, again, welcome back this evening. We've been missing out, but tonight I want to talk to you about a topic that I think is important. It happens all the time. Everyone has experienced, and that is diarrheal disease. Now, Dr. SAWH, before I go on, I know there are two different spellings to diarrhea. One is in English Imperial, and one is American Standard. I hope that's where diarrhea stops, just by spelling, and there isn't anything else that is different in any other circumstances.
I know, it's funny, I mean, because, lots of people are trained in the UK, and you use the UK spelling, and then when you look at lots of the Ghana is so associated with the US that you have lots of US spelling for words. So sometimes I'm writing a letter and there's always English or American spelling.
Right.
Nevertheless, it's the same thing. We all know what it is.
Right, indeed. So, Doc, I want to talk to you about diarrheal diseases, this evening. And again, first of all, in the best way possible, in the best and shortest way possible, define for us what diarrhea is. What it really is diarrhea?
Right, so we all know diarrhea, as we define it, as most people know it as, is a passage of loose stool. Mm-hmm. So by definition, really, it's a passage of abnormally liquid stool associated with increased frequency. And usually the increased frequency is defined as greater than 3 stools per day. Mm-hmm. Now, so there are lots of definitions that we can dissect scientifically, where they look at the volume of stool or the weight of the stool, the consistency of the stool, the frequency of the stool. But for all practical purposes, is a passage of abnormally liquid or unformed stool with increased frequency greater than 3 times per day. Now, it can also be subdivided into acute and chronic diarrhea, where acute diarrhea is defined as less than 2 weeks or 14 days, and chronic diarrhea is defined as greater than 2 weeks. In some texts, they would say chronic diarrhea is greater than 4 weeks, and they describe persistent diarrhea between 2 and 4 weeks. But nevertheless, most acute diarrhea, acute means short-lived, mm-hmm. It is usually less than 2 weeks, generally. Now, why is diarrhea important? I mean, we did constipation the last time.
That's right, yes, that's the last
I thought as a follow-on, diarrhea might be since we are on the gastro tract, I thought diarrhea might be a pertinent subject. And to the viewers, again, I'm sorry that we missed a couple of weeks. I was doing some holidays abroad.
I hope you enjoy yourself. I hope you had an enjoyable holiday, though, Doc.
Oh, yeah, fantastic. As a matter of fact, I was in Canada and the US, and I went to this store to buy a Guyanese restaurant. And one of the girls there saw me, said, I know this voice.
Oh, she know from the show?
Someone who was looking at our show.
Wonderful, wonderful. Yeah. Right. So, yes.
Hello to...
but that's hard, Doc. Well, you know what? They say all work and no play make Jack a dull boy. So I hope you had a wonderful time. But you talk about watery stool. At the moment, somebody gets watery stool, because there's so many names we have it for in we refer to it in Guyana. But the moment somebody starts having watery stool, we associate that with diarrhea. Now, from my own experience, a lot of times when you pick up an infection like a bug or a bacteria or so, diarrhea is happening. And is that the body's reflexes or the body's way of flushing this unwanted?
May very well be, but actually the whole pathology or the stuff that's happening in the body is not necessarily the body is trying to flush it in every case, depending on the cause.
Okay.
As we know, majority of diarrheal diseases, acute diarrheal disease will be caused by infection. And what happens in infection, as you know, our gastrointestinal tract produces digestive juices. So ever so often we produce liquid and mucus and all those water come into the bowel. Mm-hmm. What happens in infection, generally, the infective organism, be it a virus or a bacteria, there are different theories where they get attached to the walls of the intestine and they create increased secretion of fluid. So that increased secretion of fluid would give rise to a diarrhea. So, that's the kind of thing. So, yes, of course, the body naturally would, once you have increased secretion, you have increased peristaltic movement, that is contraction of the bowel and expulsion. So, and of course, that would also get rid of the bacteria. But the body has a whole set of systems to get rid of infection generally. Mm-hmm. Our immunologic system gets into play, and our white blood cell, they start to fight the infection, and there are various other ways where we try to get rid of the infection. But quickly, let me just highlight the importance, why diarrhea is very important, and I'll tell you a story. It affects about 2 billion people worldwide per year. 2 billion people worldwide per year. And it accounts for, it causes 1.9 million or up to 2 million deaths of children under 5 per year. And that equates to about 5,000 deaths per day.
Wow, diarrhea.
5,000 deaths per day, diarrheal disease account for, mostly in developing countries. But the fact is, if you're thinking 5,000 children under 5 dying.
Yes.
From diarrhea disease, it's enormous, and it's very, scary. And I mean, let me just, one thing that come to mind, and this haunts me unto this day, whereby it was so vivid for me. I don't know if you know, when there was this public service strike in Guyana many years back, there was an inquiry about that. And I was at Georgia Hospital, and we were running the accident and emergency service was only running. And in the morning, while I was going in, there were lots of protesters along the road in Newmarket. That's Newmarket, yes. The entrance to the hospital.
Right.
And there was a lady with a child, a young child, maybe 2 years old, in her hand, and she's trying to cross the barrier to get into the hospital. And she couldn't get into the hospital. And I was walking in, and of course the security guard and people at the barrier, they saw me as a doctor, and they said, "Fine, doc, you go through." And I said, okay. The lady ran up to me and said, "Doctor, my child is ill, and he's been getting diarrhea and vomiting. Can you get me through?" I said, yes. I told the guards, and I tried to, weave my way through the protesters, and I got through. And when I took her straight to the A&E, when I put a child on the couch, the child was dead.
Wow.
And this is so dramatic. I mean, on to this day, I remember vividly. The child, she had a dead child in her hand.
Yeah, waiting to come into the hospital. Yeah.
Because she said she was waiting there.
Right.
To get into the hospital. And the protesters were not allowing. There were too many people blocking the entrance.
Child died.
And she couldn't get in, and the child died. Now, that is, it's so hurtful. And the fact that she didn't know, and I'm not sure. I mean, that of course can happen rapidly. A child can deteriorate rapidly.
Yes.
And diarrhea disease is very impactful. We see children all the time contracting diarrheal disease. And thankfully, for the most part, it is self-limiting. and most people get better without any major intervention. But it can be fatal, and it's something very serious.
Wow. And when I hear about deaths under any condition with that may seem like something small, and those things bother me. But besides the watery stool, I mean, watery stool is the telltale of diarrhea. Are there other symptoms?
Absolutely. So you can have vomiting, as we know classically we say diarrhea and vomiting. And when so you can have vomiting. So those are the classical ones. However, most of the cases, I will talk about some the causes, but and then you will know different cause can give you different symptoms, sign and symptoms. But classically, our diarrhea would be diarrhea, vomiting, abdominal pain. As you know, most of the time, as I say, the stomach, you'll get gripes as a colicky type of abdominal pain. The pain goes and comes. Lots of time, if it's infective diarrhea, you can have fever. So you have a high temperature, and you can have associated aches and pains in the body, headache, generalized weakness, we call malaise, and anything that goes with any type of flu-like symptom. So you can have a type of flu-like symptom associated with diarrhea. So besides your diarrhea, vomiting, and importantly, you would get dehydrated. And then we have to look at the signs of dehydration. Now that's the danger. So what are the signs of dehydration? You would look at someone, the eyes are sunken. So it looks, sunken eyes. They're babies especially, they're crying without tears, dry eyes. The mouth is very dry, tongue dry. You would see, we do something called the skin targa. So if I hold the skin and pinch it, and I releases it, it stays like that. So there's decreased targa. You have, what else? You would have decreased urinary output. So they're not passing urine. Now that's a telltale sign, and that's a danger. So I would always tell anyone, if you see a child, a marker of severe dehydration is no urinary output. If a child hasn't passed urine for a period of time and there are signs of dehydration, we don't waste time. That child should be seen by a doctor ASAP, may need rehydration. Because eventually, if you go into that state where you lose so much fluids, you can have what we call cardiovascular collapse. So your blood pressure drop, you don't have enough blood volume, then not enough blood going to the kidney. What you have, the kidney shuts down. So you have kidney failure. And it can be serious. And in other types of diarrhea, infective diarrhea that is serious, like cholera and typhoid, they can even cause sepsis. So the bacteria itself gets into the blood system, like in typhoid. It gets into the blood. So besides bacteria getting into the GI, gastrointestinal tract, it gets into the blood and you have septicemia.
So, Doc, thank you so much for sharing the symptoms with us. But something crossed my mind. I mean, when we were talking earlier, you spoke about acute diarrheal disease, and you spoke about, and not too long ago, you were talking about kids and children, at a very, babies especially. When I was growing up, there was this talk about gastro. I remember grandmother talking about gastro, children dying of gastro. Are there some similarities? Is it the same, or is gastro and diarrheal disease two separate different things?
In the context of Guyana, what we refer to as gastro is similar, is the same. So it usually, we call it gastroenteritis, and it's often used interchangeably. That is, gastroenteritis and acute diarrheal disease, they are used interchangeably. However, technically, they are not the same thing. Gastroenteritis means inflammation of the stomach and intestine.
Okay.
That by definition. So, however, when we have lots of diarrheal disease, if we check the stomach is not actually inflamed. Because when I classify, I will tell you some classification as to the causes of diarrheal disease. You may find that you can have diarrheal disease that affect the bowel, that is a lower bowel, and it doesn't affect the stomach. So technically, that is scientifically, if we were to just dissect it, we can't say gastroenteritis and acute diarrheal disease necessarily the same. There are lots of similarities, or they cross over. However, we use them interchangeably often. So for the layman, I would say we can use them as the same, to mean the same thing.
Okay, good.
So gastroenteritis generally we say in children.
Thank you. What I want to ask you now, Doc, is like, when do we start worry? When do we need to start worrying?
All right. So I normally say, patients call me all the time, or they will come in for diarrheal disease. And I would just give you a typical approach of how I would approach a patient with acute diarrheal disease. So first, you take a history. Okay, I have got diarrhea for the past 3-4 days. What else do you have wrong with you? Do you have any vomiting? So if there is vomiting, then you would say, fine, this can be a little bit more serious, because the treatment for diarrhea is that we don't really actually need to stop the diarrhea, because often it is difficult to stop the diarrhea, but we need to give fluids, as in rehydrate. So you're losing, and we have to put back. If you're vomiting, then it becomes difficult to replace the fluid orally, because every time I give you some diarrhealite or ORS solution, you're going to vomit. So vomiting would be one of the things that we'd be wary of, and say, fine, let us pay more attention to this. Vomiting. Sorry, you said, what was the question?
When do we need to worry? When do we need? Yes,
sorry.
That's right. No, that's all right.
So if you have associated symptoms, and the other thing is, if you have systemic symptoms would mean that this diarrhea has overtaken you, in that it is a little bit more than just a simple diarrhea and vomiting. So if you have high temperature, so you become a little bit septic, so I'm thinking, hey, the whole body is affected now. If I see you're not passing urine, and we talked about that as the urine, not passing urine can be a sign of not losing too much fluid, and your system is collapsing, your cardiovascular system, your blood pressure, your pulse goes up, blood pressure gets low, and you're not passing urine. And of course, patients who travel from abroad and they've been in contact with certain serious diarrhea like cholera or typhoid. So I will be worried if if a patient comes in and says, Doc, I've got a diarrhea, it's severe, as in 10 times a day, I'm vomiting another 10 times a day, I'm not passing urine, I'm having high temperature. That patient I would say, this is a little bit more serious, and we may have to intervene earlier than later. However, so the approach for patients, generally I said, you come in, I would want to know, besides the diarrhea, what are the symptoms? 2, have you traveled abroad? 3, are there anyone else in the family with similar conditions? So I know it's an infective type of diarrhea. And those are the symptoms, the things I'll be looking for. Now, in terms of the approach to that patient, if it is a short-lived diarrhea, 2-3 days, I've got it, been abroad and I come back, and the diarrhea is less than 2 weeks, and there's no blood, again, also I want to know if there's blood in the stool. So if there's no blood in the stool, there are 1 to 2, 3 vomiting, let's say not more than 5 vomiters per day, your diarrhea not more than 4 or 5 times a day. No, you're passing urine normally, there's no blood in your stool, you don't have any temperature. That diarrhea, I would say just diarrhealite, ORS fluid, rest.
Okay.
Now, if you have other complications and more severe forms of diarrhea, then we would then go through the other stages as to what else we can do.
All right, good. Now, when do we need to investigate? How do we go about this? Do these things warrant investigations when these symptoms show up? Or you just how you do to go to the deepest, understand this more?
Indeed. So in simple diarrhea that is infective, that you get diarrhea for just a few days, most cases of diarrhea, we don't need to do any investigation. So if you tell me your diarrhea is less than 2 weeks, you've just come back from a holiday, or you've eaten some you've eaten some food that you think is due to that food, like food poisoning, I wouldn't investigate a diarrhea.
Okay, right.
But if a diarrhea lasts for longer than 2 weeks, if it is associated with those severe symptoms, high temperature, severe vomiting, severe diarrhea, of course we can investigate. And what are the investigations? We can do a blood test to see if your inflammatory markers are high. So there's something called ESR-CRP. If you're passing blood, I would want to know if you're anemic, so if you're losing lots of blood. I would also want to know if you're dehydrated, so I'll do a kidney function test. There are some diarrhea can also cause bleeding disorder. So we'd want to see if there are signs of bleeding, so I can do a blood clotting profile. Secondly, I would want to check a stool test. So a stool test will tell us what type of organism it is. If it is an infection, if it's viral type illnesses, whatever, bacteria, parasites, so you can have other parasites, amoeba, there's something called amoeba, you can see that in the stool test. What else we can do? We can also do investigations where in chronic diarrhea now, diarrhea for other causes, you can have diarrhea from pancreas. If you have pancreatitis, you can have diarrhea due to that. I may want to do an ultrasound scan. You may want to do, if there are signs of bowel obstruction, as in you have distension of the abdomen or signs of rupture of your intestine, we may want to do abdominal x-rays looking for gas, bowel dilatation of the bowel. And also in chronic diarrhea, again, you may want to do things like a camera in the stomach, that is colonoscopy, to check for that. There are also some imaging tests like CT scan, MRI. These are for more chronic diarrhea when we are looking for other causes. Now, importantly, before we run out of time, so far I talked mostly about infective causes of diarrhea. So the majority of cases of diarrhea that I explained that we see in children, that we see in people who are traveling, if you've eaten contaminated food or water, and if you have others in the family members that are affected. Now, we can say safely these diarrhea are due to infection. An infection can be viruses, it can be bacterial. Now, usually the history is very clear. I've been in contact with somebody with diarrhea, I've eaten something different, or I have traveled. And those diarrhea would be either diarrhea and vomiting, you don't normally be so ill. Now, if someone comes in with diarrhea that is more protracted, that is long standing, you've got diarrhea more than 2 weeks, more than 4 weeks. Importantly, again, I want to know if there are any blood in the stool, because inflammation of the bowel, so those other diarrhea, we can classify them as different parts of the bowel or the gastrointestinal tract. So you can get diarrhea due to inflammation of your intestine, and they have large intestine, small intestine, even stomach condition. Patients who have had previous stomach surgery, they can have diarrhea due to that. Cancer of the bowel. There's something called Crohn's or ulcerative colitis. The inflammation of the bowel. These are inflammatory bowel disease, can cause diarrhea. There are some endocrine causes of diarrhea. Patients who have got thyroid problem, hyperthyroidism. There's some hormonal imbalance, carcinoid syndrome. There are lots of conditions that can cause diarrhea besides infection. There are some congenital causes of diarrhea. People are born with some sort of enzyme deficiency. You can have diarrhea. Celiac disease, you can have diarrhea. Some allergy and food intolerances, cow's milk allergy, some protein allergy, food allergy. Generally, you can have other skin manifestation associated with bloating and diarrhea. What else? Big on diarrhea as well, as in chronic diarrhea also, would be drug side effects. Patients will come in and they have used some medication, simple antibiotics, they have diarrhea. So diarrhea is not only infective, For the majority of acute diarrhea lasting less than 2 weeks, we can say it's usually infective, and most common cause, viruses, and then you have contamination from bacteria and food poisoning.
All right.
Chronic diarrhea generally, you then want to zoom in to all those important and chronic diseases. And that's really your summary. Importantly, patients, especially if you're over 50, you've got chronic diarrhea, you've got weight loss, or you've got blood in your stool, that by almost always warrants investigation to rule out cancer.
Wonderful. Doc, we got about 3 minutes more to go. I want to ask you about treatment because that is important. Let's close off with treatment, please. And viewers, remember, continue to send in your questions. Next week, we're going to be answering those questions. Treatment, Doc.
All right, quickly on treatment. So a majority diarrhea, infective diarrhea, most of those cases are self-limiting. Lots of patients will come in and say, Doc, can I have some antibiotics? I think I've got an infection. Somebody else in the household have got diarrhea. I would say no to antibiotics because, again, antibiotics can make the diarrhea worse. Majority of infective diarrhea, there is no need to treat with antibiotics. What you do, you want to rehydrate the patient, rehydrate by the form of oral rehydration salt, or they have them selling like Pedialyte, DIARRHEAL, and the normal sachet, ORS sachet. That's your hallmark of treatment. So while you're losing fluid, you want to give back fluid. Then, of course, if you've got pains and temperature symptoms, you can give paracetamol. You can also give anti-motility drug. These are drugs to slow the bowel. You can give anti-sickness drug to prevent vomiting. Generally, they're not very effective, but there's no harm trying if you have profuse vomiting. Anti-motility drug like Imodium, loperamide, codeine, they can be used to slow the bowel movement, so it slows the diarrhea. Generally, we don't want to give too much of drug to stop the bowel from moving because then you can end up with obstruction.
Right.
So as you rightly say, the body has a mechanism of getting rid of the bug. So if you expel it, that's good enough, but there's a limit. If somebody's coming and say, I'm getting 10 diarrhea a day,
that's
and
right.
they consider giving them something. If they're having 2 or 3 diarrhea a day, I would say, fine, let it ride its course, and it's self-limiting. Antibiotics have got a place. So in patients who have got signs of cholera, who have got signs of salmonella, so they've been in contact with patients who have had that, or if they have got things like there are other conditions, Yersinia, Campylobacter, there are different bugs that can cause bloody diarrhea. Usually these bacteria, they're a little bit more severe and they give rise to bloody diarrhea. So if there is bloody diarrhea, as in an acute diarrhea less than 14 days, I would consider antibiotic. But generally, I would send off a stool sample to test first, confirm that it is a unique type of bug, and then we will treat with antibiotics. But for the most part of acute diarrhea, there are viruses. Antibiotics don't work for viruses, so there's no need for antibiotics. But the ones that give you Yersinia, Campylobacter, Shigella, those Salmonella, we can consider antibiotics for those. In the chronic diarrhea, where you're looking for other causes, your pancreatic insufficiency, there's a condition where the pancreas don't produce enough enzyme, you can have diarrhea. Of course, we can treat that. The drugs we can use like Creon. And of course, if you have anti-inflammatory bowel disease, Crohn's, ulcerative colitis, there are specific drugs we can give for those. And that's your treatment in summary.
Well, thank you so much, Doc. Thank you so much. Viewers, I hope you enjoyed tonight's show. Dr. Saw is so, he presents this thing so well for every one of us. If you're new on the show, remember this show comes to you every Tuesday night at 8 o'clock right here on the Guyana's Critic platform and on my page also. Akash Prasad. So thank you so much for joining us. I hope that you sent in your questions, and look out next week when we are going to be, myself and Dr. Saw, going to be looking at your questions and answering those questions. So thank you so much for joining us. Anything you want to say in closing, Dr. Saw?
No, again, thanks again to you and your team, and of course to the viewers for tuning in. I know we have had a little hiatus, a little break, but I hope we are back and up and running now, and it will be, we'll continue to do this and share the knowledge.
Indeed. Viewers, thank you so much for joining us. Have a wonderful rest of the evening and stay healthy.
Thank you so much. Good night.